here at the University of Kansas Health System. Happy to be back with you, broadcasting live from the Dolph Simons Family Studio. Joined this morning by, of course, Hawkeye, and by the mayor and the CEO of the Unified Government of Wyandotte County. Good morning, Mayor Alvey. How are you, sir?
Doing well, thank you.
Good. We'll be back with the mayor in just a moment. But let's first start with Hawkeye.
Yeah.
This was not a great weekend in Kansas City.
No.
I mean, for the Chiefs last night, that was good. A little worried about the defense, but you know, Patrick Mahomes, geez, the guy's money.
It was an early holiday miracle, like
It was
a Hallmark movie almost.
Yeah.
My daughter loves the Hallmark movies for Christmas. But, you know, sometimes you want to hit the century mark, whether it's wins or what that is. We don't want to hit the century mark for patients, but unfortunately, we have 100 active COVID patients in the hospital. Over 40% of those are in the ICU. 46 patients are needing ICU critical care for that, and 26 of those patients are actually on the ventilator. So we still have 39 as well who are in that recovery phase. Unfortunately, we did have a few deaths over the weekend as well. So the hospitalizations definitely are following all of that huge trend in the new cases that we have seen starting a few weeks back. Unfortunately, in Hays as well, they have a large amount of patients, 39 total patients. 36 of those are active, and 3 of those are in that recovery period. So that just continues to be a larger proportion of their total inpatient beds as well.
Yeah, it's been a tough weekend. So that puts us at around 140 patients overall. And I know many hospitals in Kansas City and our metropolitan area. I know Lawrence Memorial had struggled with the number of not having enough ventilators this weekend. I know we were taking patients from all sorts of strange places over the weekend. It's tough out there right now. And I think we have to get the message that there's nothing more important out there than trying to follow the rules of infection control to keep yourself safe. Because right now, we're on fire. There's only one way to put out that fire, and that's to use those rules. Let's start with our reporters and see if there's any questions, Jill.
Mary with the Wyandotte Daily, she knows that the mayor is going to be on, so this might be a fairly good transition. And then I also have a question from KCTV5. Mary's wanting to know, what enforcement is there of new health restrictions in Wyandotte County?
All right, well, let's go right to Mayor Alvey. Yeah. First of all, Mayor, how are you today and how are things?
Doing well. I'm happy for the win last night, but very, very disturbed by the numbers just reported by you.
Yeah, they have grown, and we are clearly under increasing pressure. You know, I think people are starting to get tired, and we'll keep our heads up and work hard. But this is a little more difficult time right now. So, what about mask mandates? How can we try to enforce those?
Well, it's this debate keeps going on whether this how we handle the pandemic needs to be governmental control. Whether that's at the local, the state, the federal level, or whether it's personal responsibility. And I suggest it's both. Each one of us, if we would just simply comply with the mask mandate, follow the protocols of infection control, as you suggested, maintain social distancing, avoid large gatherings, we could simply turn the tide on this. Insofar as we don't do that, we're going to continue to face this kind of thing. And I think it's really too bad that people will expect us to solve this problem by enforcement. There is simply not enough personnel to enforce everyone wearing the mask. That is each person's responsibility to wear a mask, maintain social distancing, avoid large gatherings. So if we do get a report of an event where people are gathered in large numbers and there's not masking, the police will go and have a conversation with those folks and remind them that this is the statute, the ordinance, and they need to comply. We really try to avoid fines and so forth. Let's hope we don't have to do that.
Well, I think that's exactly right, and it really is about the rules of infection control and all of those things that we've been talking about this entire time. You know, we have this shared humanity where we're all in things together, but for some reason we want to fight simple logic and truth. And it's odd to me because it's a fool's wisdom that takes us on a journey that says masks don't work when there is so much evidence that proves that they do. And the best evidence is what's going on inside hospitals every day. We have 139 patients today that are COVID positive or been here for COVID. There are 100 patients with active COVID disease. How many of our staff are getting sick directly from the patients they take care of? And the answer is they're not. And the reason is because they wear masks. Anybody who tells you that masks don't work or they don't believe the evidence is following a fool's wisdom. There is no question at all. And the infection rate inside hospitals of staff who wear masks taking care of COVID-positive patients proves the point. The rate is virtually zero. What would we be like if people weren't wearing masks in a hospital, Hawk?
Yeah, people would be ill. We would be ill. I would be ill.
We wouldn't be here.
Wouldn't be here.
And we wouldn't be able to keep the hospital open. So, I mean, it is a fool's wisdom that pursues the logic that says a mask doesn't work. And it endangers all of us when you don't wear a mask in all these simple circumstances. It is not that hard to try and take care of each other and keep us all safe until the vaccination arrives. And I was reading today, again, another trial. AstraZeneca has data that shows it's between 65% and 90% effective in Brazil, South Korea, and another country, and I forgot what the other two countries were. Ongoing trial here in the United States. KU is part of those studies if you want to get enrolled. And I think that it's really important to note that will be the third effective vaccine. Johnson & Johnson can't be far behind to start announcing their results. And we think that it has been, at least it has been reported by I forgot where I read it this weekend, that the Pfizer vaccine will probably be reviewed within 2 weeks. I think it's going to be reviewed December 10th or 12th. And when it gets reviewed, if approved, then they expect the vaccine to ship the next day. That is a timeline that is before Christmas. So help is really on the way. It is not that hard to get us there.
Yeah, I think things are going to be different a year from now for sure.
Oh,
and
totally.
the CDC, even on Friday or Saturday, came out and had more backing and endorsement of mask wearing as well. I listened to a podcast this week in virology, which I would encourage everybody to go listen to. And one of the best quotes from this past weekend was, "Wake up, people." I mean, it's that simple to wear masks, to do these things to help save other people, to prevent infections. And just as you said, if you are not doing that now, it's not because you're out reading the data and understanding, it's because you just don't want to do it, and you don't want to believe that it does help yourself and other people, whether it's you as a private citizen or a business owner. Not endorsing mask wearing, is leading to kind of what we're seeing right now, what we have seen for the past 10 months.
Yeah, it is a critical time right now because really things are hanging in the balance as hospitals are overcrowded, and we're having a harder and harder time finding a place to take care of patients, Jill.
KCTV5 wants to know the state has set aside, state of Kansas, $1.5 million of its federal coronavirus relief funds for a big television, radio, print, and social media campaign that they're going to come out to educate on mask wearing. There are some people that are wondering maybe it'd be better to put the money toward enforcement of mask wearing, and they would like your thoughts and Mayor Alvey's thoughts.
Well, Mayor, let's first turn to you. What are your thoughts about? First of all, $1.5 million is not going to go very far for mask enforcement across an entire state.
No, unless KCTV5 is going to donate the television time. I would suggest that the messaging is clear, and we need leadership to stand behind our public health directors. We need leadership to understand, especially elected leadership, to understand what the CMOs across the region are telling us. It was what CDC reported this past weekend, I think, that in Kansas, in those counties that had a mask mandate, there was a 6% decrease in the infections. In those counties that did not have a mask mandate, there was a 100% increase. It's clear. And I keep asking people, just tell me, who among your loved ones are you willing to get the virus? So my motto for the holiday season is the best thing we can do in the holidays, the best gift, is to neither get nor give the virus. And it simply comes down to, as you suggested, the fundamentals of infection control.
Yeah, we've made this way too hard. So I was listening to my podcast this weekend on the New England Journal of Medicine. They think, oh, nobody can listen to it but doctors. No, actually, the podcasts of the New England Journal are really good, and anybody can listen to this. And there's one right now. They interviewed an infection control person from Norway in there, and how different it is in Norway versus the United States. She said that people believe in government and in their elected officials. And I think what we need to do is we need to have a lot more Mayor Alvies out there trying to help us along this crisis, because again, this is not a hard question, and unfortunately when we take it as a red state, blue state, or Republican, Democrat, and all this politicization of it, that's just a terrible thing, right? The coronavirus is not political. It does not care who you are or where you're from. It only cares that you're a viable host. And if you can get upright, or actually if you can't get upright, you're a viable host. And the problem is that you can then spread that virus to other people, Hawk.
Yeah, I like Mayor Alvey's excellent point about the Kansas mask mandate research article that was published in the CDC. That was one of their main papers that also led them to further put out this more endorsement of the masking. So
yeah. Makes no difference. Okay, Jill, other questions from reporters? All right, not hearing any. I bet there's a few out there from the audience today.
Yes, there are.
Morning.
Oh, wait, we have a reporter.
I got one. Go for it.
Yep. Good morning, doctors. It's John Pepitone over at Channel 4.
Hey, John.
And I was wondering if you could talk a little bit more about the AstraZeneca results being reported today. Specifically, the idea that this is a more tried and true type of vaccine, not based on the gene-based technology that Moderna and Pfizer are using. Do you think that will be more comfortable for folks to have an option like that is not something that's never been used as a vaccine before?
That's a great question. Yeah. So, Hawk, that's right up your alley.
Yeah, it's really difficult to say. We understand what the vehicle is to deliver the payload. The vehicle is that adenovirus, and it is an older technology. The Moderna and Pfizer use nanoparticles with mRNA. It's really difficult to say. I think we are all waiting for the final safety results and efficacy results. I think once it comes down to it, it's probably not going to matter much, because so far they have all proven safe, and we are getting more and more of the efficacy data. So I think once that is established, just as there are several companies that make influenza vaccine, there are going to be several companies now that are making coronavirus vaccine. I'm not sure it will play too much a part in it, but again, I think we are all waiting for the final safety data, but they are all looking safe at this point.
Here's how I would do it. I think that this messenger RNA vaccine is going to be safe, and it's a pretty cool idea of how they're packaging the vaccination. And it's different clearly than the AstraZeneca. Early on, I would have said the same thing that you just said, which is that, gosh, that AstraZeneca one feels a little better to me because it's been tried and true. And we also know that what the side effects of those vaccinations are, and there are few, but they do occur. So far, the data that we're hearing about on the mRNA vaccine shows very few side effects, which is really encouraging. We need to see the published data. We haven't seen the published data yet, but we'll get to that soon enough. And as we do, we'll be able to make a more informed decision about which one we think is going to be the most effective and the safest. Now, the other advantage the AstraZeneca one does have is that apparently it's very easy to ship. It gets to be stored in a refrigerator, not really cold, and it's very stable in the refrigerator for a long period of time, which will make it especially important in countries without a lot of infrastructure.
That's the thing, too, is we are trying to get so much vaccine out to so many people for in such a quick time. We need as many different vaccines because not one manufacturer can manufacture all of these things. So as we get further into this, just as you said, but the other thing is the AstraZeneca has published data, or will be publishing data, on the older age group as well. I'm not aware of that for the Pfizer and Moderna, so we need to get those vulnerable populations, that older age group.
And the other point, remembering that since most of these vaccine, and AstraZeneca is one of those, has to be given twice, then what happens is, you think about that, that's if there's 5 or 6 billion people in the world, that's 10 to 12 billion doses in a year's time, if you're, whatever compressed period of time. That's approximately a very big number, and that's a lot of vaccination. The other thing that was interesting on the AstraZeneca trial, again, these are preliminary results, but it looked really good because the people who got vaccinated appeared to be protected, and they had two different dosing regimen. The dosing regimen that was actually the lower initial dose followed by a higher second dose had 90% effectiveness versus I think 67 or 65% effectiveness if you had the higher dose twice. So a lot of questions about why that would be true, but we also, as you and I were talking about earlier, one of the, was it the Pfizer
Eli
data,
Lilly.
or Eli Lilly, yeah, that suggested that some of the other doses, that actually the higher dose wasn't as efficacious as the lower dose. So.
And they were giving larger doses in those trials as well. So that's why you do the science, you do the trials, you get the data so that you can present it to people and be transparent about all that stuff.
Yep. And then also there was a JAK1 inhibitor. Do you want to talk a little bit about that? I mean, it's kind of confusing to talk a little about what JAK1 inhibitors are, but also what it meant for our in-hospital treatments.
Yeah, it's a new, well, it's not new, but they were studying it new for coronavirus. And they had started that trial, I think, back in March and April, so pretty early on. And it is just one other compound to help reduce the amount of inflammation or the cells that, the immune cells in your body. That's kind of a brief overview. But that study was also done, I believe, without the use of steroids and dexamethasone. It did look encouraging, and I think there is an EUA for it right now, or it's being applied for. It's not going to change anything we're doing right now in the hospital, but it is one other thing we can move to. So.
All right. Let's see if other questions are out there.
The question I had was, how soon is the U.S. trial of the AstraZeneca vaccine expected? When is it expected to show results? Because the company says it won't seek FDA approval, in our country until they get results here.
Yeah, that's
and I guess it was paused for September and much of October.
It was paused for a while, and I looked at the AstraZeneca articles that I saw, didn't really specify a timeline, and we can get back, because we could talk to some of our folks here who are involved in that trial and see if they have a timeline, but my understanding was it would be into January before it was closed.
Yeah,
Is that what you're heading to with the recruitment? I know they're continuing to need more recruitment in minority communities, and I think that's one of the things they're trying to accomplish still, but I'm going to guess it's, to be honest with you, I do not know for sure. Let us do some more research and come back to you about that question.
Thank you.
Any other questions out there? Jill.
Jennifer wants to know, people who tested positive in Jefferson City and are being quarantined are being told by their medical staff that they are immune for the next several months. Is this true? Her concern is that people that have been told that they are immune will run around maskless.
Yeah, it's a great question. Yeah. Don't run around maskless because you can still you won't get as sick theoretically, but you can still show the virus.
Yeah, you probably do have immunity. We really, if you've been tested and positive within 90 days, we typically don't retest you here in the hospital. You should have immunity. You should have B cells, T cells, antibodies that are there to help reduce infection, reduce your symptoms, and hopefully reduce your ability to transmit to other people. But just because you've had it, it is absolutely not a reason to not do the things that we've talked about, not meet in groups, not social distance, not wear a mask, because of all those other things. So you continue to have to do those public health guidance measures, even if you have been infected.
Mayor Alvey, what is your sense of the status here in Wyandotte County and surrounding counties? How are we doing in the battle against the virus? What's your sense about the mood of the citizens out there around us?
Perfect.
Well, frankly, I'd have to say they're probably, in many ways, still struggling with that same conflict of resisting the fact that the virus is here and therefore resisting the measures we need to take. Our health department obviously closed bars at 10 o'clock. I had significant concerns from people who own bars about that, and I understand that. And it's really their livelihoods, and I understand that's totally understandable. And yet at the same time, I hear from so many people who encourage me and say, continue to do what you're doing, support the public health department, which I plan to do anyway. But I think that there is still this resistance to the fact that we have to suffer this. And as a nation, we're not used to suffering, or we think the suffering itself is evil, when in fact something that causes the suffering is evil. And the virus is the enemy, and we have to continue to focus together. The virus is the enemy. Our fellow, citizen is not the enemy. The virus is the enemy. Let's take the enemy as the enemy, and do we need to stop it? So I think that there's still a lot of resistance and anger, but also people are tired, and people are now getting upset when others are not complying. And I think that's only going to increase.
Yeah, I think you said it beautifully, and I think that is exactly right. So this last weekend, my wife took me down to an anniversary trip in northern Arkansas to Crystal Bridges, and I was very nervous about traveling. However, interestingly, we made one stop for gas on the way down in Missouri, and then we got to Bentonville, and Benton County, Arkansas. Arkansas has a mask mandate, and Benton County, everybody wore a mask, and you couldn't get into the museum there, Crystal Bridges, unless you had a mask on. They limited the number of people in there. You always felt safe. And you had an appointment time. You could only be in there for so long. It was really, they had really done a great job. And it was a great example of how to create a safe environment, even amongst a very unsafe time. And I'll tell you what, the community, it was like, they were really good. And Arkansas's rate of coronavirus is 40% of that of Kansas and Missouri. And it's all about infection control. When you follow the rules, good things happen. When you don't follow the rules, Hawk, bad things happen. We've seen that, as you mentioned, on the mask research in Kansas, looking at the counties that have mask mandates and those that don't, out there on the CDC website for everybody to read. The counties that have to wear masks do a lot better than those who don't. So it's just, it befuddles me, and maybe because I'm a healthcare provider and you see these patients coming in who have such ravages of this disease. You meet people like Neil Garmark on our show, and you realize the real impact it has on our lives. And real hope is on the horizon, brought to us by science, thank you. And the virus is out there, and we can control it on our own if we're just willing to make some sacrifices in the short run.
Terry wants to know, what about asymptomatic infection? Is that rate? She wants to know what the rate is.
Oh, it's
Is it
unfortunately. It's pretty high. And Hawk, the other thing that came out at the end of last week is that over half of all transmissions are being caused by asymptomatic, which is why you got to wear a mask.
Yeah, absolutely. 40, still say up to about 40% of asymptomatic, but also, maybe up to 50% in that asymptomatic, pre-symptomatic period as well. And that's why the masking is so important. And they've been saying this for a while, but more data has come out to support that. So it's important that, just as you said, if we are doing those right things, where you saw the masking, you can do some of these activities and still have lower risk or be safer. But you have to make sure that those mitigation strategies are prevalent and are being followed so that we can keep businesses open and people can do things in a safe manner, or at least with lower risk.
Jill.
Judy says that there's a hospital director in North Dakota who sent an email to hospital employees saying that he had COVID and he didn't need to wear a mask anymore. And she just wants to know.
The CEO of Sanford Health said that. That was terrible.
Yeah. Very irresponsible, just again.
And I think he got pummeled by his own in the media and in other places, as he should have, because that idea, well, I've had COVID, I don't have to wear a mask, and I'm going to show it to you all. That's just, what are you thinking?
It's backward thinking.
Well, you're a CEO, and you're supposed to be acting responsibly, and you're a head of a hospital, a large hospital corporation, and you go out and you say, I don't have to wear a mask, but you do? Come on.
Yeah.
Do better, man. Do better.
Lori wants to know if the increase in inpatients is due to taking in patients in the KC area, or are we seeing more patients from out KC? And she wants to know if even from other states. She wants to know what our population base
Yeah, I don't know the exact numbers today, but I believe they are about 30% or 33% from outside the Kansas City metropolitan area, which means over 2/3 are inside the Kansas City metropolitan area. That is by far the largest number.
Yeah.
We are getting people throughout Kansas and Missouri. We have taken a few from out of state when they simply couldn't find a bed between here and there. And they're not all, and those patients who come to us from other states sometimes have other diseases, and there's just no intensive care beds, there's no ventilators left. You know, folks, we're on fire. I said this last week, we're on fire. There's one way to put the fire out, and it is to wear your mask and to follow the rules of infection control. You have the ability to fight the fire and put it out. But in the meantime, we put people at risk because we won't try to do the things that will help us control that. And as a result, we're in trouble, and we got to do better.
Yeah, I think it's getting increasingly more difficult to take people from out of the metro area. But just as you said, you know, last week I had a patient who was admitted here who could have been treated at a local ICU in rural Kansas, but was unable to. This wasn't for COVID, this was a separate infection, but they were unable to because they were just overwhelmed with COVID patients. So we are also getting transfers, just as you said, for things other than COVID because there is no room at those other hospitals because of the capacity of those local hospitals.
Yeah, not all hospitals have the same level of care, right? And so as a result, when you look at some rural areas, they don't have ICUs, they don't have ventilators. Well, if you get into trouble like that, then you got to say, I mean, I think rural hospitals are fighting the good fight and are doing a great job at trying to keep people in place until they need critical care. And once you need critical care, you're going to have to move out. Interesting article this weekend as well, as we increase the number of ventilators, and there's so many more being used and so many patients who need that ICU coverage, you start running out of doctors and nurses who are trained in ICU coverage. And so that's another valuable resource we're running down on. And I'd have to stop and count how many new ICUs we've opened for COVID here, but it's crazy what we're having to do.
Yeah.
Jessica has a good follow-up question to that. She says, are most COVID patients in the ICU? And she goes, what is the average length of stay for a COVID patient currently?
Yeah, so most patients are not in the ICU, but unfortunately the numbers have climbed high. Why don't you go back through the numbers today?
Yeah, we have
44. The numbers break down really easily.
Yeah, exactly. We have 100 inpatients. 46 of those are in the ICU, so 46%, and then half of those at 26 are using the ventilator. And we've seen throughout this, the numbers have been different. We haven't had that many or a high proportion in the ICU. 40% is a pretty high proportion. Sometimes we've had 10 patients in the ICU with only 2 on the ventilator, so 20%. But right now we're running just over 50% on the ventilator. So it varies and it fluctuates. You know, from week to week or almost day to day.
But I also think that's partly taking some of these patients from outlying hospitals, because if you just look at the random patient who comes into our emergency room, it's going to be a different ratio. But when we start bringing people in, we only are getting the ones who need to be ventilated, because rural hospitals will keep them up to the point that they really have respiratory failure, and then they have to come to an ICU.
And I think the length of stay still, for the most part, probably remains short, especially for the ones that are just on the unit. Yeah. Again, once you get to the ICU, you're probably looking at a minimum of 10-day.
Yeah, that's a 2 to 3 week stay. Yeah, exactly.
Isaac said he saw that the case curve might be starting to flatten in the Kansas City area. Is that true? And what does that mean?
So what we know is that, the coronavirus, and take a swing at this with me, but the coronavirus is in equilibrium with whatever activities people have in society. Mm-hmm. And so there was clearly a rise after schools opened. People went outside, they started partying more, and then they started coming back inside, and we hit an equilibrium. And we've been around 1,200 new cases in the Kansas City metropolitan area for about 10 days now. Mm-hmm. Mayor Alba, does that sound about right to you?
That does sound right. Yeah. Mm-hmm.
When you're at 1,200, and that's the number, then what happens is the rate of infection falls behind, it comes up, and it takes about 10 to 14 days for those cases to translate into the ICU. So we won't know the full effect of being at 1,200 a day for another several weeks, because then those 1,200 a day, they're out giving other people a disease, and so then it begins to double on itself, so to speak, and that's when you have what we call logarithmic exponential growth. And so we'll have to see what happens, especially over the Thanksgiving weekend. I think we're all really worried. We are scared about the Thanksgiving weekend, because people go inside, large group gatherings. They may want to do it how they always have Thanksgiving, and obviously they're going to be sitting close together. They're not going to have masks on. That is a super spreader event, and I'm not talking about the cranberry sauce. So, Mayor Alvey, what are y'all doing for Thanksgiving this year?
We're just keeping it to my immediate family and to one other person that we've been in regular contact with, so we're all in the same bubble, and we've had to constrict that, obviously. So put the word out to all of my kids, and then we just have to, in their job, wherever they go, they're not going out to bars, we're not going to restaurants. I just cannot fathom what would happen, for instance, if my wife should contract the virus. So just not going to go there.
Yeah, Hawk, how about you?
We've had the CDC now imploring for a week or more, please do not travel. Do not take the virus from one area to another area of the country. But we know that there are still people who want to travel, who still feel that they can travel. They don't have to really adhere to these things, or they can't get the disease, or they can't spread the disease. So unfortunately, we would still recommend everybody really listen to the CDC, try not to travel, because we know that getting together just spreads the disease. I'll be working, so it'll be fun, just seeing patients and really trying to make them better and improve their quality of life, and for their loved ones as well, getting them home as much as possible.
So my family is getting together. We usually have about 30 people. We're down to 8 this year. My 88-year-old, I'm not supposed to say her age anymore on the air, folks. I apologize to that. My wonderful mother-in-law said to me, you don't have to keep telling everybody my age.
Right.
So she is over at Bishop Spencer Place. Well, they've done a great job on infection control, but she won't be coming out with us because she's concerned. My daughter and her boyfriend are here. They've been quarantining for 2 weeks before they got here, so I feel very comfortable that we're all wearing masks in the house, and we'll continue wearing masks. And everybody comes, there'll be a total of 8 of us there, and again, that's down from 30. So we're trying to do the thing that we have to do to make sure we stay tight and take care of each other.
Kim wants to know, this kind of speaks to, is it safe to go and get health care? She has 70-year-old parents. One of them has Parkinson's, going to get physical therapy. They just wonder about, is it too dangerous, and maybe should they forego the physical therapy? Could you speak to keeping, doctors'
Yeah, I tell you what, I think places like that are incredibly safe. And you say, well, that's self-serving. No, actually, it's not. It's quite the opposite. I think patients need to get their care, otherwise they won't do it as well. And what we have seen is people with advanced cancer presenting because they didn't want to go get their mammogram. We had Dr. Wagner talking about that a few weeks ago. We've seen people who have had heart attacks and come in late, and their heart is much more damaged, strokes where they've had more permanent deficit. That's not where you want to be. Where you want to be is to go get your care. And healthcare facilities have done amazing jobs at making sure people have stayed safe. Dental offices, same things. Go get your dental work done because dentists have done a great job at keeping their offices safe. Even your hairdresser, okay. The CDC, we keep talking about on this program, the examples in Springfield where people wore masks and didn't get the disease even though the two hairdressers were positive. It is very possible to stay safe out there, but you've got to follow the rules of infection control, and I think you can do that with physical therapy, as long as the therapist has a mask on, you have a mask on, and you're following the rules as best you can. Now, granted, that physical therapist is going to be close to you. That's okay. You're both going to have masks on, and I think most offices are doing all this great work in infection control. I feel like it's safe, Hawk.
Yeah, absolutely. I think all of these healthcare facilities have taken these steps to do that. And so really get your routine care, whether it's screening, primary physician, physical therapy, dental work, get that routine care because all of these societies, all of these groups have taken great measures to make sure that they are safe as well as you are safe.
Jill, I think that there may be a reporter on the line from Channel 5 with a question. Am I right about that, or did I miss that? Okay.
Okay. Gosh, there's so many questions. Debbie wants to know, once a vaccine is given, how long will one need to mask, or will it be required?
That's another great question, Hawk. What do you think?
I don't think we know the full extent of that, and I don't think masking or mask mandates will or probably should change until a majority of the public is vaccinated. So I think that is a unanswered question right now. but I don't believe it will happen until, again, we get rollout to the mass populations. Not just the healthcare workers, are those vulnerable populations in those phase 1A and 1B type of scenarios, but more in the later spring and summer. And so I think that was still ongoing, and by that time, I think it will probably be just as a lot of this is, what are the infection dynamics in your community? So I think that's going to matter a lot as well.
Yeah, I think that's right. And I think obviously we don't really know. Anthony Fauci said by next October, things are going to feel 95% back to normal. So there's one estimate, but that had to do strictly with people getting vaccinated. And I think that the CEO of Pfizer was more optimistic. He was saying next summer, and I think Moderna may have weighed in there as well. So I know Mayor Alvey would appreciate our getting a little bit more back to normal. And those small business owners, Mayor, would certainly appreciate that as well. Anything that you're hearing about the status of another stimulus package or any other aid on the way to try and help some of the folks who are involved in small business and really perhaps taking the brunt of the viral economy?
No, the last I heard was that I think Senator Schumer mentioned that he had reached out and that Senator McConnell was willing to come together to discuss a package. I think they were still far off on the numbers. I think Schumer was looking again, they're looking in the trillions, and I think McConnell was saying nothing north of $500 billion. His point is it needs to be strategic and well placed. I would agree with that. I think that's wise, but I think we really do need to provide some wind to the sails of our small business. And certainly until everyone is comfortable going out and feeling they're not going to get the virus, they're going to continue to constrict their economic activity. Whether local, state, or federal government comes out with more restrictions and mandates, there are others who would simply say, I'm not going out until I feel comfortable. And until there is that vaccine available, I don't know if that's going to happen. So, but again, I thought your point, when you went down to Arkansas, there is a way to conduct business that is safe. Let's again follow the rules of infection control. Let's see what we can do, but let's not overstep our limits, because when you give this virus any oxygen, it just flames up.
That's totally right.
Diana wants to know, why are restaurants still staying open past 10 p.m.? I thought they were required to close at 10.
So I think it may depend, Mayor, a little bit on what part of the city they're from. Talk to us a little bit about the differences in the counties and the cities here in the metro.
Right. So, as you know, 3 weeks ago, when the CMOs put out their, the warning that where we were heading with hospitalizations and the stress on the system and especially on staffing, the public health directors responded with their own recommendations, and the CMOs again came out in support of those recommendations from public health. We pulled together the core four to discuss what measures we might take. Chairman Eilert, I think, tried very hard to get the Johnson County Commission to agree to those recommendations, which included limits of gatherings of 10 or fewer, but also closing bars and restaurants at 10 o'clock. Because when you go to a bar and a restaurant, you're taking the mask off to eat and to drink. The longer you are there, the more opportunity you have to be exposed to the virus, the more opportunity for someone who is infected to spread the virus, because without a mask, you're spreading it. Obviously, after we have a couple of drinks, I know I get a little louder and I get a little more boisterous, and so I probably expel, the virus, would expel the virus further. And so that's why 10 o'clock was chosen. It was not just a mandatory, let's just pick a number out of the hat and see where we go, 10 or midnight. But the Johnson County Commission chose to stay open until 12. Jackson County and Kansas City and Wyandotte County came together to agree on 10 o'clock. We just simply follow the recommendations of the public health and really the encouragement of the CMOs as well.
Thank you, because I'll tell you what, I think we may be having to have another, even a more harder conversation, because if the hospital numbers continue to rise like they are right now, and we can't take care of people who are having heart attacks or strokes or in a car accident because we have no beds, and leave alone all the COVID patients, then I think that's going to require even a more stringent outlook at things, because then we're really in trouble. And I think we're approaching being really in trouble. One more
Okay,
question,
Betsy
Jill.
kind of has our last question for today, and we'll get to the others. Great questions in here. She says that she wants to know if the virus can travel through the ventilation system. She's concerned because kids are, coming home from college. She's in her room without her mask on. Kids are in their room without theirs. Is there a worry in that?
Yeah, Hawk, I think the ventilation thing and all that travel, probably not as much of a concern as early in the virus.
Yeah, I think the simple answer to that is no. We know a lot of places wanting to protect clients, wanting to protect their employees, did a lot of the HVAC kind of system stuff. Early on, when we had the Princess Cruise infections, they really kind of ruled out that there was a lot of there was any ventilation spread. Now, obviously, if you're sitting by a vent and it's blowing air and you have somebody that's 8 or 10 feet away, you can do it that way. But I think through the actual venting, through the actual HVAC system, it's not going to be really a concern or a risk, especially if you're in other rooms and you're worried about heat and somebody who's sick in one room. Because we've also seen this when people do isolate into their own room or their part of their house, there isn't infections in the other part of the house, in the household. So I think the simple answer to that is no, I wouldn't be concerned about that.
Mayor Alvey, final thoughts for today.
Just continue to think about one another, and I always, every time, I have to be mindful and deliberate with everything I do. And so if I'm really concerned about spreading the virus to others, especially my loved ones, then I'll do everything I can not to get the virus, and also assume that I may have it, be pre-symptomatic, asymptomatic, and not know that I'm spreading it. So I have to make sure I don't give the virus. As simple as that. Neither get nor give the virus.
Yeah, it is. Isn't that so true? And thank you for your first of all, thanks for being on our program today, and thank you for your leadership and stewardship in the community and championing the health of everyone. We could use a lot more Mayor Alveys out there. So thank you, sir.
Yeah, absolutely.
Hawk.
Yeah, I mean, we are seeing an increase in hospitalizations. I think this stems from an increase in the cases that we saw probably from about October 25th or 26th when we started to see that curve going up in infections in the metro area. This is unfortunate because this is before even we've gotten to Thanksgiving. So obviously, if you need to travel, car travel is much safer. We've talked about things to do. If you have been able to quarantine or isolate yourself for the last 10 or 14 days prior to meeting with family, that helps as well. Just as you said, masking in the household helps as well. So try to do all those things, really mitigate the risk. We know people want to be together. We know that these things work, though. These things help. And we also can do these in our businesses because we know businesses have to stay open. People have to continue to pay bills, pay the mortgage, put food on the table. So if we can continue to do this, do the masking, do the distancing, that will help decrease the cases. That will help keep our economy running, and people will continue to be safe.
Tomorrow, Mayor Quentin Lucas from Kansas City, Missouri, will be joining us to talk about how that mask is going on the Missouri side of the state line. We will be delighted to have him with us on this program. It's his first time on it, and that'll be a hoot. So I was driving in today, and there was a report on NPR, and they're talking about comparing the number of deaths now from COVID-19 and saying every 3 days we have the same number of deaths from COVID-19 as we did from all the terrorist attacks on 9/11. And I think about that. I think about what happened on 9/11. And when you left that after that day and you started seeing on roofs and in flags and signs everywhere, united we stand. United we stand on against terrorist attack. Let's think about SARS-CoV-2 as a viral terrorist. Let's stand together. Because right now, things are on fire. And how many times will you play with fire before you're burned? We can do this. We've done it before. We did it in the spring. We can bend the curve again. We can keep our businesses open by keeping each other safe. It's a very simple action. Wear a mask. Keep your distance. Cough into your elbow. Don't go out if you're sick. Wash your hands. That's how we stay safe. So until tomorrow, we'll be back here. And remember, there's still no place like home.
Everyone's working real hard right now, and that's an understatement, and everyone's tired.
Not just in the urban communities, but in the rural communities, there are still a lot of the general public who don't want to wear masks or adhere to public health guidance. And taking the brunt of that is those rural public health officers and those nurses.
Basically, 1 in 5 of our beds are filled with COVID patients. There is not another disease process, not cancer, not heart disease, not anything, not one other disease process that takes up 20% of the beds in this hospital. Not one. How is this different from a bad flu season? The H1N1 flu season, right? A bad flu season requiring a lot of hospitalization never had 125 patients needing to be hospitalized at the same time.
Despite everyone working so incredibly hard and being very, very overwhelmed and just worn out, there is still this element of positivity that they're in this together, and we've got this under control, and we're going to make it through this.
This is very quick to get worse and very slow to get better.